Hello, welcome to my YouTube channel. My name is Whitebo Iradukunda. I'm a third-year student in Bachelor's of Physiotherapy at HEMORRHAGE University. Today I'm going to be presenting my surgery assignment of Rubrics 3, and the topic is clinical features of hemorrhage. Before going to clinical features of hemorrhage, let me start with defining hemorrhage. Hemorrhage is a release of blood through the blood vessel due to injury to the blood vessel. Types of hemorrhage in summary. Types of hemorrhage can be according to involvement. There will be internal hemorrhage, which is bleeding inside the body, and external hemorrhage, which is bleeding outside the body. And then types of hemorrhage according to the blood vessel which is affected to be venous hemorrhage, arterial hemorrhage, or capillary hemorrhage. Types of hemorrhage depending on the cause. It can be primary hemorrhage, which is direct injury to the vessel. It can be reactional hemorrhage that happen within 24 hours of injury to blood vessel or surgery, and also it can be secondary hemorrhage, which occurs after 7th day to 14th day of surgery. Or the clinical features that are mainly seen, starting with external hemorrhage, it's very clearly seen because it's just bleeding that happens. The bleeding, it can be either due to venous or arterial as from the classifications. And arterial bleeding, it has typical blood which is bright red in color, and venous bleeding is usually dark red in color. And other common clinical features of hemorrhage according to system, that's how I try to classify them, starting with cardiovascular system. The clinical features that occurs due to immediate loss of blood that happens in the body. And the first thing that happens immediately is reduction in blood volume in the body. And that is followed by hypotension. Hypotension is reduction in blood pressure less than 100 mmHg of systolic blood pressure. Though hypotension is not seen in many patients due to peripheral vasoconstriction that happens as response to reduction in blood volume. And another feature in cardiovascular system is tachycardia. Tachycardia is increase in pulse rate. This is commonly seen where there is marked increase in heart rate that happens up to more than 100 beats per minute. It is a classical symptom that happens, which is also known as 3D pulse. In later stage, there can be shock, hemorrhagic shock, and also multiple organ dysfunction syndrome may be seen, which can further lead to death. The next system which is affected is respiratory system or pulmonary system. This has symptoms that are demonstrated by the first thing is air hunger. Air hunger is deep sigh respiration that happens whenever there is acute breathing most of the cases. And another thing that happens is tachypnea. Tachypnea is increased rate of respiration, which goes up to more than 20 respiration per minute. The next system that may be affected is CNS. CNS is affected in such a way due to reduction in blood flow to the brain. There is restlessness in the body, and also there is excessive sweating. In addition to that, due to reduction in the blood volume in the body, there is dehydration, which is seen by activation of the CNS to stimulate thirsty system in the body. Okay, the next system is integumentary system. In the skin, there is change in appearance of the skin. The skin is going to be paler in color and also clammy and cold. That's the thing that happens. And the extremities of the body parts and extremities like toes and fingers, there will be cyanosis. And the next system that may be affected is urinary system. Urinary system, this happens due to reduction in the blood volume in the body, and this is shown by reduction in the urine output, which is also known as oliguria. Thank you for your attention, and with that, please share if you liked it, subscribe, and also come back next time for the new videos.